one, if you're out of pain, you want to stay out of pain, but you want to improve in performance. We look at, it's kind of like a hierarchy of movement, right? So the base is going to be a range of motion, flexibility, strength, and then stability and power, speed. So when somebody is like a high performance athlete and they want to get better at golf, we're looking at taking them into the gym side and, you know, throwing some weights on, making sure that their movement mechanics are really sound, and then build on consistency through different various exercises, and then increase the intensity, whether that be adding weight or adding speed or power or stuff like that. So yeah, definitely there's like a range that we'll take them through.
If art is a metaphor for life, or art imitates life, that's what a round of golf is, right? You got a map. I know how long each hole is, but how's it going to go? I don't know. We're going to grip it and rip it, right?
Yeah. See where it takes us.
Yeah. So Paul, why golf physical therapy? Why those particular athletes? What about those people resonates with you that you want to hang out with them a lot?
Well, I guess it started when I just got married, and I was in PT school, and my father-in-law gave us a set of golf clubs.
Okay.
And at the time, you know, I was like in my 30s, and I was like, oh, you know what? Golf is a sport for like old people, right? I'm a young dude. I was playing volleyball, I was doing other things, and I was like, yeah, that's not for me. But then I really found out that it's probably one of the toughest sports to learn because it's all about movement. It's the only sport that the ball doesn't move. You have to move around and make this thing. So it really lent itself to the study of physical therapy. Kinesiology was one of my most favorite subjects, and that's how it started. And then it was just down a rabbit hole, basically. I was really selfish, really, because I studied the golf swing, got certified and everything, because I wanted to be a better golfer. And along the way, it lent itself to helping other golfers.
Now, hold on. Were you a physical therapist then, or did golf lend you to, did being introduced to golf lead you to PT? Which one was it?
No, I was a PT first.
Got it.
Yeah. I was working, and I'm like, I was just out of school, and then I found out, I got those clubs, and then I found the Titleist Performance Institute.
Yeah.
And then their approach was just like, oh my God, this like makes so much sense. It's just like PT. It's like the founder, Greg Rose. He's a chiropractor. And I went to his courses. I was like, it resonates with me so much because it was just like movement.
Right. All right. So the goal of this with our audience of physical therapists, I want to break down, maybe you'd be speaking to the person you were when you first got that set of clubs, right? Maybe it's someone who wants to treat a golfer, but it's
Sure.
like, I really don't know much about it. Or maybe you do know it from the sports side and
Yeah.
you are a therapist, but you're like, hey, maybe there's some things I need to know, right? Because doing a sport doesn't mean you know how to treat a sport, and vice versa, right? You've really got to get in there and understand it. So let's talk about commonalities, things you see regularly anyway, in terms of injuries. What are some of the things that come through your door that make Paul start to nod when the person's sort of telling their story and you're like, okay, seen this before. I know some questions to keep probing to figure out what that is. So what are typical, or what's common in golf?
Well, I'd say the most common thing that people come to see me, especially if they are golfers or they're injured, is right-sided lower back pain for right-handed golfers.
Okay.
And then either that or left-sided knee, hip, or shoulder stuff. So it's usually the trail side back, and then everything else is like lead side.
Okay. Why is that? I'm trying to wrap my head around it, and I'm trying to do it backwards because I'm a lefty. I'm like, okay, wait, okay.
Yeah. So it's definitely tough if you are lefty. I've treated some left-handed golfers, and I have to kind of take a second. But in your backswing, you think about, it's a slow backswing, and maybe there's a pause at the top of the backswing, but the quickest movement and the most violent movement is on the downswing, where you're trying to create as much force and speed downswing. And the one thing that happens to the back is that there's a lot of side bending that happens and rotation. So your pelvis rotates one way while your upper back, your thoracic spine, kind of lags behind a bit, but there's a lot of side bending, and that's what gets people in trouble with the right-sided back. And typically, again, it's going to be the other side, left side, because that's or the lead side. We'll call it the lead side for left-handed golfers. That hits the ground first, and it has to kind of make that break, or you have all that acceleration. And if you don't have good brakes, it's kind of useless or even dangerous. So it's like a Corvette without a handbrake or brakes at all.
All right, so we're looking at back and knee, it sounds like, or backside and lee side in terms of
Yeah.
common injuries. What are some typical things that you do? How do we get golfers back on the course?
Mm-hmm. So people will come to me via two paths. It's either they're a golfer who has no issues and just wants to play better, or they're injured and they want to get back into golf. Regardless of where you are, it really starts with a full body kind of diagnostic. It's based off of the SFMA and the TPI golf movement screen. We're just looking at the body's stability and mobility patterns. Like every body has that mobility, stability, alternating pattern. And if we see things that are faulty, like say for lower back, if your lower back is designed to be a stable segment. And if the thoracic spine, that's supposed to be mobile, or the hips, they're supposed to be mobile. A lot of times if people have tight upper backs or tight hips, then the lower back becomes an unstable segment or mobile segment. And then that's when we run into problems because those roles get reversed.
What do you wish you knew as a physical therapist working with golfers when you first started? Like, what would you tell your younger self about approaching this particular group of people?
So I think, and this applies to like a lot of other patients, is that when somebody comes to see you, you just have to learn their story and understand what their goals are. Because before, when I was fresh out of school, we had that script. You get this script from the doctor, and we're like, all right, knee OA, low back pain, whatever, and you just focus on that one spot.
Right.
So a lot of new grads be like, all right, I just need to know everything about that one little thing. But then, understanding what the person's goals are and like figuring out, how, what's the ultimate goal? Like not just to get out of pain, but what else? If I was able to snap my fingers and get rid of that pain today, what would be your ultimate successful outcome goal look like? And just understanding that, and then understanding that you have to take the person as a whole. That's probably the biggest advice I can give to my younger self.
Yeah. All right. So along the same lines of that, you're saying take them as a complete person, right? So getting their story is their subjective. Let's talk
Yeah.
about objective. What are some things that you do with golfers so you can so you can sort of get an eye on their visual story? I'm imagining, you have them bring a club, or there's some clubs in your office. What are some things you have them do so you can get some good eyes on what their body is telling you?
Yep. So once we get done that physical exam, it's like a 30,000-foot view of how they move. We can make inferences into how they could swing a golf club. Like, what are your swing characteristics that might show up? Some things that you might be trying to work on with your swing coach. And then we take a club. I've got a hitting mat here, and we take like a two-dimensional video. I just kind of break out the iPhone, have them swing. I take a video from down the line and face on, and I just kind of draw lines and see, all right, what does that look like? And then also just for fun, a lot of times we'll do a swing speed analysis. I just put my radar thing and measurement on the ground. People just like to swing and see what kind of numbers they get. So that's for fun. Yeah.
What's good club head speed? I've never tracked any of these things, and I am a bottom third golfer. But what are averages, or what's close? I have
Yeah, I
no
mean, like
context.
you could see like on the PGA Tour, they're like swinging upwards of 120 miles per hour and up, right? So if you're like an average, say, 15 or 20 handicapper and you're playing, and if you get 90 to 100 miles an hour, that's pretty good.
Right,
A lot of clients that come to see me are like really in the 60s and low 70s.
and that's club head speed, right? That's not ball
Club
speed.
head speed, yeah. So we have a sensor. I just have like a stick here, and then I just put a sensor on the ground, just measures how fast that head is going through the air, and then we just get a number.
All right, so you mentioned the two ways people actually come and see you. One is people who are playing golf and want to get better, and the other is people who are injured who want to get back to it. So let's talk about those two. What's your mindset, or how do you approach people who are playing now, want to get better. Maybe they say, listen, I want to get better. I also don't want to be in that second group. I don't want to be injured. What can I
Yeah.
do? How do you explain that to a golfer?
Hey, where are you going with your PT career? That's not rhetorical. I want to know. Would you like to embark on an extraordinary patient care adventure? That's what they call it. Some people might call it travel therapy. Find out more at jacksontherapy.com. This is perfect for physical therapists who are eager to make their mark. Discover where your skills can take you at jacksontherapy.com with Jackson Therapy Partners. And here's a question for you. You frustrated with your EMR? Feel like it should do more, be easier? Yeah. Take the next step. Maybe try something new. How about an EMR that's all in one? Seamless integrations of patient portals, marketing automations, and billing, all at an unbeatable value. Plus, switching over is a breeze. See what you can do with MW Therapy and their all-in-one EMR at mwtherapy.com. And how would you like to boost your bottom line and help more people? You can do both of those things without having to work more. Smarter, not harder, kids. Boost your clinic's revenue by $290 per patient per quarter by adding remote therapeutic monitoring. You've heard about it, but you're like, I don't know where to get started. Is it complicated? Well, what if you knew where to get started and it wasn't complicated? That's what Physiotech is here for. Kickstart your RTM at physiotech.ca. That's physiotech.ca right now with Physiotech.
Yeah. One, if you're out of pain, you want to stay out of pain, but you want to improve in performance. We look at, it's kind of like a hierarchy of movement, right? So the base is going to be your range of motion, flexibility, strength, and then stability and power, speed. So when somebody is like a high performance athlete and they want to get better at golf, we're looking at taking them into the gym side and, throwing some weights on, making sure that their movement mechanics are really sound, and then build on consistency through different various exercises, and then increase the intensity, whether it be adding weight or adding speed or power or stuff like that. So yeah, definitely there's like a range that we'll take them through.
Do golfers ever want to stop golfing? If they come through that second door, if they're injured and they want to get back, do they, where are they with, hey, listen, we got to shut it down for a couple weeks because all the golfer might hear is, man, they're doing the math. How many rounds am I sitting on the bench for?
Right.
So talk to me about that second group, the group that comes in and maybe is injured and wants to get back.
The one thing that I hate saying to somebody is you can't do the things that you love to do. And, that's one of my mantras, is that my goal, my mission in life is to get people back to doing the things that they love. And if somebody says, hey, you know what, how long am I going to be out? Well, it really depends on what their pain level is and functionally how are they getting around the day. If it's really bad, if you can't get up out of a chair or out of bed without having a lot of pain, then certainly we're not going to be able to do a full swing. But with people that feel better and they're kind of getting on in their sessions and they're getting back to their normal routine, I always say, work from the hole backwards. You could always start putting and then chipping and then doing those pitch shots. And then 150 yards in, we're not going to do like a full swing driver unless you are like 85 to 90% better.
I've never heard that approach, but that makes complete sense, which is start from the hole backwards because
start from the hole back.
Yeah, that's smart because it reminds me of someone once said that golfers are single direction explosive athletes. Essentially, we don't do things balanced unless you're kind of crazy and you play left-handed to right-handed. You're typically always exploding in one direction. So that drive is very much explosive, right? Is it right to say it's plyometric? I mean, it's very explosive, right? They're not jumping.
Yeah, I mean, a lot of the newer swing styles now use the ground more often and use the lower body a lot more than they used to. And there's a lot of foot action. So yeah, there is like, especially when we're talking about that ground reaction force, there is like a big push and pull that happens in the feet. So yeah, I mean, I would consider it plyometric, sure. And that also leads into how you're programming their exercise routine, is that there has to be some type of plyometric routine or exercise in there that works on acceleration and deceleration too.
Yeah. I mean, you figure if you're going to do I mean, for someone like me, 100 swings now, a hundred strokes now. Not all of those are going to be drives. A lot of it is going to be trying to hit out of the rough from somewhere off the fairway.
Yeah.
But that's a lot of explosive work.
Yeah.
Either a lot, or maybe you're like me, where I golf 2 or 3 or 4 times a summer. So I'm going to come
Yeah.
off the bench, do a bunch of explosive exercise, and assume not to be sore the next day or to not injure myself.
Right, right, right. I mean, that leads into your maintenance program, right?
Right.
And one of the other things that I tell people is that, as you age, you want to maintain your durability, your resiliency, so that you can do those things, whether they're random or seldom or infrequent, and not feel like you're hesitant or have some apprehension to kind of go out there and perform your best. You want to maintain what you got.
Yeah. I think we're in a good spot too, because I think a lot of the professional golfers these days, it really started with, I guess, Tiger Woods years ago, with
Hmm.
this focus on, it wasn't just an accident, it was skill, but there was also preparedness. He was taking care of his body. His goal was to play as long as possible, as high a level as possible. So I think, do you have to do as much selling to golfers these days on why exercising will help your golf game and vice versa?
Yeah, that varies from person to person. I think the trend is moving in the positive direction. But when I first started, working with, or when I first opened my practice, I found that it was kind of hard to kind of get golfers on board with a fitness type program. They would just rather go to the driving range and bang balls and be comfortable with, happy how they're feeling. But I think, a lot of the media and then some of my messaging that I've been putting out to golfers has been resonating a little bit better, because you have to, all athletes, whether they're golfers or any other sport, basketball players, you need to be able to maintain it, and that's why the fitness routine is so important.
Yeah. How about trends, right? A lot of times, and I've loved to see some of the funnier videos online about all the things golfers will buy
Mm,
to help their swing, keep them in
yeah.
shape. They wear stuff on their head. They'll hold stuff in their armpit. Anything to change alignment. But what are some good things you recommend golfers actually use in terms of exercise equipment, or things they
Mhm.
use on their own when they're not with you? Is there any things that you actually like enough to suggest?
I think from a fitness standpoint, if I had to have like one piece of equipment that I could use for a variety of exercises and applicable to across different movements and sports, I would say a kettlebell. A kettlebell allows you to be very flexible with how you apply that force, how you move it around, and off on the course. If there was something that I would say, from a skill standpoint, with getting the swing, you know, one thing that I personally have been working on is just trying to keep my arms together in my backswing. So there are, devices and balls that go between the forearms, so that when you do address the ball and go to your takeaway, it stays connected to your body. So you kind of take away from one unit and then you can swing down from there. So I would say that that's probably the one thing that I would use on course or on the driving range, and then the kettlebell would be in the gym.
I like that. You mentioned TPI. Any other sort of organizations that put out great content besides yourself that you learn from? Any other people that you seek out information from for golf athletes?
Man, I think, TPI is one within the golf space, but I think as a physical therapist and, fitness instructor or whatever, I think my, I guess, mentor, my idol is Kelly Starrett. I
Yeah,
think everybody knows him. I watched him early in the days when he was just doing mobility WOD videos off of his phone. And he, every day that he puts something with his mobility app or website, it's like it's always golden. And it's so applicable to like the everyday man.
perfect. Last thing we do on the show, Paul, is called the parting shot. That is
Yeah.
your opportunity for a mic drop moment or a soapbox statement. Thanks to our friends from the Academy of Orthopedic PT with their resource, Current Concepts of Orthopedic PT. What would you suggest for your parting shot? What would you want to leave physical therapists who are either treating golfers or who want to? What information would you leave them with?
I think, just do better. We can do better. We can always improve, always learn something new every day. And don't try and shortchange your clients. Meet them where they are, and just be better than what you are. 1% more better every day.
Yeah, I like start from the green, the hole, work backwards. It'll get you back
Yeah,
to teeing off on the first hole. Paul, appreciate your time. Thanks for sharing some insight with us in golf athletes.
yeah. Thanks, Jimmy.